Today, we're going to talk about a fundamental shift happening in healthcare, and it has nothing to do with what's happening inside the clinic. It's about the very first moment a patient decides they need help, and how AI is completely changing that moment. So, I want you to really think about this for a second. Put aside everything you think you know about patient acquisition, your website, SEO, ads, all of it. Because the way a patient discovers you is being rewritten from the ground up, and it is happening way faster than any of us expected. You see, the patient journey doesn't start where it used to. For more and more people, their very first consultation, that first conversation about a health concern, isn't with a doctor, a nurse, or even a search engine. It's with an AI. And this is a huge difference. Think about it. Yesterday, a patient would type some symptoms into Google, and they'd get back a whole page of blue links, a list of possibilities they had to sort through themselves. But today, they're asking an AI a direct question, and they're expecting a direct conversational answer. It's a totally different ballgame. And these platforms, these are the new front doors to your practice. ChatGPT, Gemini, Perplexity, these are becoming the default starting point. This is where patients begin to understand their condition. And crucially, it's where they decide who they should trust to help them, often before they've even heard your name. So here's the kicker. Unlike Google, which kind of throws a bunch of options at you and says you figure it out, AI does the opposite. It synthesizes all the information it has and gives back a single confident-sounding answer. It doesn't give you options, it gives you what it believes is the solution. And that changes everything for providers. Which leads us to the central problem this creates. If AI is the new front door, what happens when it doesn't even know you have a key? This is what we're calling the AI invisibility problem. To really get this, you have to understand that AI just doesn't work like a search engine. First, it's not searching the live internet in real time. It's using the knowledge from the data it was trained on. Second, it doesn't rank you based on keywords or how many links you have. And third, it funnels everything it knows into one single answer. All the old rules for getting found online just went out the window. So what does this actually mean? It means that beautiful website you paid for, your meticulously crafted brand, all those ad campaigns you're running, to an AI, they're basically invisible. It can't see your logo or get persuaded by your clever marketing. It only understands one thing: structured, verifiable expertise. And this leads to a really scary new phenomenon: silent patient loss. Just think about that. These are people who need your exact skills, but when they ask an AI for help, it recommends someone else because it simply doesn't know any better. You never get a phone call. You have no idea you were even in the running. This forces us to look at the whole situation differently. Because really, this isn't just a tech problem or a marketing challenge. When you get right down to it, this is about the most important thing in healthcare: trust. So you have to ask, are we just talking about the next marketing fad? Or are we looking at a potential crack in the very foundation of how trust is built? If a patient's first interaction leads them away from the right expert, that chain of trust is broken before it even gets a chance to form. And honestly, this is probably the most important idea to take away from all of this today. If that first critical conversation is now happening with an AI, then being visible and accurately represented in that AI's answer, well, that's not marketing anymore. That is the new ground floor for patient trust. Okay, so if the problem is being invisible to AI, the solution has to be becoming visible, but in a language that AI can actually speak. And that means we need a completely new strategy, a new discipline, really. And that new discipline is called Answer Engine Optimization, or AEO. Now, this isn't about trying to trick an algorithm. This is a much more clinical approach. AEO is the work of taking all the incredible expertise inside your practice and structuring it in a way that AI models can digest it, verify it, and ultimately trust it enough to cite you as an authority. So how does that work, practically speaking? Well, first, AIO makes sure the AI understands your precise scope of care. Not just that you're an orthopedist, but that you specialize in a specific non-invasive knee surgery for young athletes. Then, it validates your expertise using signals the AI sees as authoritative, things like your published research or clinical trial data. The result is that when a patient asks a highly specific question, the AI can accurately point them right to you. And let's be crystal clear about what this is and what it isn't. AIO is about building a permanent AI visibility infrastructure. It's a tool for building trust at scale. It is not advertising. It is not just putting a new coat of paint on SEO. And it is definitely not about buying leads. This is an entirely new category. Which brings us to our final and most urgent point. This shift isn't coming. It's here.
And it's forcing every single healthcare practice to make a strategic choice.
Right now, there is a window of opportunity, and you can hear it closing. These AI models are actively learning, building their foundational knowledge of the world. But pretty soon, that understanding is going to get locked in. The work you do now to teach these systems who you are will pay dividends for years to come.
So really, the choice couldn't be clearer. You can either actively take control of how AI represents you and your expertise, or you can do nothing and passively let AI send your potential patients somewhere else.
And so I'll just leave you with this one final thought. In the very near future, when a patient turns to an AI for their first piece of medical advice, will that AI have what it needs to know that it can trust you?